There we go. Okay, everyone. Hello. It's been a minute. Welcome back. We are so happy to have you here, and we are so happy as an organization to welcome our certified social worker, Jennifer Schaefer. Welcome to Hope for HIE, Jen.
Thank you. Thank you. I'm super excited to be here.
Yeah. So today the goal is just to introduce yourself to our community. We'll go over kind of the scope and role of and your involvement at Hope for HIE. And then as always, we'll end with some of our favorite resources for families to connect into that you recommend. But before we get into all of that, I would love for everyone to just hear kind of like your social work experience, your career background, and then ultimately what led you to this position at Hope.
Perfect. Yes. Thank you. Yes, my name is Jennifer Schaefer, Jen. My career started like many social workers do in the child welfare role. I worked there for 2 years and then decided I wanted to do more with my career. So I went back and got my master's degree in social work. And since then, I have been doing medical social work. I have been working in hospitals for over 17 years now. That path started in adult social work and adult hospitals. I work mostly in ICUs and with transplant population as well. But I've always found myself working with some of the sickest of the sick patients and just those high stress critical care needs, collaborating with families, helping families and patients navigating the hospital systems and what comes next and what resources they need. So I worked in an adult hospital for about 10 years and then realized that I really did want to get back to working with children and families. That's really where my heart lies, is with kids. And so I transitioned and got a job with my local children's hospital working in a level 4 NICU. I don't know if I really knew what I was getting into, honestly, because I thought, oh, I've worked in the ICU. What an amazing experience. The families, the providers that I work with, I'm just truly blessed, honestly. Being able to walk on someone's journey with them when they're having, honestly, the worst days of their lives. When babies are born, we all have this picture of what it looks like. And unfortunately, that is not how it looks for everyone. So just being allowed to be in that space with families, providing support, check-ins, guidance, and referring them to resources. That's what I've been doing for over 7 years. And honestly, I'm ashamed. I kind of knew about Hope for HIE. The brochure was on my back wall of my coworkers and but I never really knew what it was. And last year I met the previous social worker, and she kind of really got into the nuts and bolts of what Hope for HIE does for this community. And I was just like, I could have been doing more. So it was very eye-opening, hearing what this organization does. And when I saw that she left, I instantly I needed to do more. I want to do more. Working in the hospital, we provide a lot of really great supports. People have social workers and chaplains and child life and music therapy and psychologists, merchandise, all of these different programs surrounding them and loving them and doing the best they can. And then people discharge from the ICUs and we're kind of like, bye, good luck. And they're isolated to navigate. And so I think this was my opportunity to kind of switch gears a little bit and try to be that ongoing resource and support and helping people navigate. So I look forward to what I can do and seeing where this takes me.
We're so excited to have you. And yeah, you mentioned Haley. Haley did such a wonderful job with outreach. And that's something, that's the reason why that flyer was on your bulletin.
Exactly.
So even the fact that that was there and kind of a looming presence, I think is a big step forward, because it takes a lot to to have people know us as an organization, trust us, and trust our resources, and make sure that we're a solid resource for families, et cetera, et cetera. So this is ultimately a segue into the next section, which is what you're going to be doing for us, right? So we're so proud to have you on board as our social worker. I know January has been 104 days long thus far. And that's just because there's so much that you have, that you're dipping your hands in. I mean, there's so many programs and initiatives and facets of your role. So for those of you in the community who don't know or need a refresher, Jen here is going to explain to all of you what your role with us can entail. And to guide you, Jen, these are going to be things like, our support groups and our peer perspective series, peer mentorship program, the hospital ambassador expansion, and then just global outreach. So I will just sit back.
Yes. And
explain that to us.
Yeah, so I just started here in January, so I'm still getting my feet wet and learning about all these amazing programs, but definitely trying to jump in and, keep the momentum going as much as I can and hopefully allow these different avenues to grow. One of my big roles is the helping with the support groups, excuse me, and the peer perspective series. We have 2 standard support groups that we do a month. One is the new to HIE, and then the second one is the loss support group. Other than that, we try to think of different support groups that could help our community members come together and to work together and share their experiences and learn from one another. So putting together different topics, we are always looking for topics that if you think we're missing something obvious or you're feeling like, oh, I would love this, or a lot of people have questions about this. We would love to hear about what topics you would like us to try to cover to bring more of you together. And also for the peer perspective series, putting a panel together and have people talk about how they've navigated. Those are experienced family members and that have been touched by HIE, that have walked the walk and have taken the turns, the ups and downs, and have gotten through it to give some perspective to parents that might just be starting out. So that's just one way that I'm getting involved in keeping that going. We have a really great peer mentorship program, and I'm super excited that one of our peer mentors is taking a little bit more of a role, and I'll be partnering with Allison Moyes. She's going to be helping me more with navigating, connecting mentees, people that are looking for a little bit more of that one-on-one support. Whether it's just they're new to HIE and they're just looking they're struggling with, how do I do this? How do I make my life work? And they need just more support. We have one-on-one mentors that can kind of guide them through that. We also have some loss mentors. So I will be providing more of the support to those mentors, checking in with them, helping them with things that go on and during the mentorship, and just making sure they feel supported in that process. But Allison and I will work together in making sure that people are getting matched properly and getting the support that they need.
Yeah.
And then the other program, which is very exciting, is the HIE Hospital Ambassador Program. This was a pilot program that Haley kind of started out last year with Seattle, and they had some really great success. And the ambassador program is basically taking an experienced parent and having them being that liaison between the hospital and Hope for HIE. While you guys do such a great job supporting each other on those Facebook platforms and stuff, we're human beings and we need that connection, and having someone right there in your community to kind of provide a little bit more of that connection. They will be there to help provide local resources, making sure you know and how to navigate those hospital systems, connecting you with the Hope for HIE platform and support programs that we can offer. but also offering some local community opportunities to connect with one another. Some ideas, some things that our pilot program, Tina, had done was hosting the Hustle for Hope 5K, local meetups in a park, play dates, coffee with parents. She's getting together with parents to just put a bunch of local resources, those go-to resources that are so invaluable, just so parents have them at the ready when they have questions. So we are actually expanding. We've met with, we're hoping to expand this now to about 5 more states. We've had some initial meetings. We have some ambassadors that are stepping up, going through the training program, and hopefully getting that up and off the ground. And my role is to really support that ambassador and be that in between, just to make sure it goes smoothly. If there's questions or needs identified, that I can just kind of oversee that. And then the last piece is, like we had mentioned earlier, that global hospital outreach. We want to make sure these families know about Hope for HIE and all the great supports and resources sooner than later.
Right.
Ideally, we would want them to know shortly after diagnosis, because nobody expects that. To get that kind of news, and what does that mean? What does my life? And there's such a spectrum with this diagnosis that it leaves a lot of unanswered questions and feelings of uneasiness. So to reach out to the all of the hospitals, the social workers, the doctors in the NICUs, the PICUs, neurology groups, and just making sure that they know that we're here to support their families in various ways, to make sure they know they don't have to do anything.
Yes, you had a freezing moment, but it recovered.
Oh, sorry.
No, this is part of it. This is remote work. This is right. Internet connection.
Right.
So yes, I mean, gosh, there's so many things like you said. And for those of you who are listening and you're like, well, I've heard of the peer perspective thing, or I heard her say one-on-one mentorship, and I heard her say hospital ambassador. So all of this information for you to opt into, for you to learn more about, for you to connect in, and for you to get a hold of Jen to for direct support or for links to any of those programs that she just mentioned, it's all at on our comprehensive care network, support network, which is HIE.support. So all you have to do is go there, and you can scroll down. There's an area there to connect directly to Jen. Otherwise, as I said, there's mentorship opportunities one-on-one, and our new on-call mentorship too, for those of you who don't feel like you need a sustained one-on-one relationship and you just need on-demand help for an isolated issue or topic. That's available too. So this is all under HIE.support. And so we really want you to go there, take a look, see what you need, see what your family needs, connect with us. And then that way Jen has your information, and she can support you in that tailored, curated way, whatever your family needs. And then, as always, Jen, we always like to leave our Q&As, and in this case, our very short little meet and greet with any type of favorite resources you have, just as a medical professional and now someone who works with us at Hope. Any suggested tools or resources that you have for our community members to use when it comes to learning more about how their child or family could benefit from a social worker, or just things that you, in your 17 years of experience, things that you found helpful potentially that you could give a shout out to for our families?
Yeah. I guess I would just say ask the questions. Don't be afraid to ask the questions. Social workers, we are being embedded in so many different areas. We are not just in the hospitals. We are in the clinics, and not just specialty clinics like cardiology and neurology and stuff. They're starting to put us in primary care clinics. Insurance companies are even hiring social workers. They're identifying, and there's research to show that if we can break down barriers and get people help sooner and understand their needs, there's just better outcomes for physical health, mental health. And so there are social workers everywhere. We are in the communities, they're in the schools. If you are struggling and just not sure where to turn, we are everywhere. So reach out. If you're still in the NICU or the PICU, ask to talk to the social worker. If you're in a clinic appointment, ask to talk. Community resources, there are so many. They're not the easiest to always navigate. But just to go and look, and just don't be afraid to ask the question. I always just worry that people are sitting there going, well, I don't want to look silly, or I don't know. We're never going to always know all of the answers. I would rather people ask the question and me saying, no, that's not an option, than to not have.
Right.
I want them to have the resource, and not miss out on an opportunity to better their child or their family's outcomes. Definitely take a look at what we can offer. Those Facebook groups, I'm actually very impressed by the amazing support people provide. Just posing a question and then just watching people just support them and giving them guidance. They're amazing. I would definitely suggest linking into your state's, your HIE state specific Facebook group. That could be very helpful for more resources. While some of those other ones, those topic based, are really good with, I don't know, this is how I feel, or this is what we're doing, and people can give you guidance. But I think some of those state ones would be really good if you're looking for a particular resource. They've walked the walk, they've taken that journey, and they probably know the resources better than myself in some instances, because they're using them. So just ask. And if you're not sure who to go to or where to go to, reach out to me. Go to that HIE.support, put in a referral, ask the question, and I will see what I can do to help and guide you. And maybe it's starting here, changing here, or, hey, I just have this resource for you.
Thank you so much. We're so grateful to have you. And I know it's only been, it's really only been the first couple of weeks of January, but you know, just from insider's perspective, everyone who's kind of been with Jen and helping oversee all of this transition, she's just so passionate and she cares so much. And I can already tell she cares so deeply about being there for you and doing such a great job. And we noticed that, Jen, and we're so grateful for it, because we need someone like that, you know, in our community and obviously on our team, who just cares so deeply. And so we're so grateful to have you. And we can't wait to see a year from now, gosh, you know, like where we're going to be and like what we're going to do and who we're going to help support. It's crazy what happens in a year. And so thank you for being here today. Thank you everyone for tuning in. And again, I thank you. We mentioned her to Allison Moyes again, because she's also stepping up in this role as peer support coordinator and really helped manage that too. So I know you gave her credit. I want to give her credit too. You know, so she's amazing and we love her. So our team is growing, and the more we grow, the more we can help people. So thank you for being here. And as always, you can, I will have a blog of key takeaways. I'll have a social post for key takeaways, so that way people can see at a glance what you do and how they can connect into support. So everyone keep an eye out for that in the next week or so. And until we see you again, goodbye, everyone.
Bye. Thank you.